Department of Pathology and Laboratory of the University of Perpetual Health Delta Medical Center is among the best equipped hospital laboratories in South Metro Manila, playing a vital role in the detection, diagnosis, and treatment of illness. Our department is headed by Dr. Agnes B. Barrientos, Chair, and Dr. Nelia S. Tan Yu, Chair Emeritus. The department has a certified blood bank with additional functions, an HIV proficient laboratory, a licensed G6PD confirmatory center, and top-of-the-line equipment run by a highly efficient and licensed staff of medical technologists, drug test analysts, and specially trained laboratory personnel. The Department of Laboratory is being managed by Ms. Divine Grace A. Gonzalez, the laboratory officer, and supervised by Ms. Ana Camille M. Laudentia. It is also an active member of the National External Quality Assurance in Hematology, Clinical Chemistry, Microbiology, Parasitology, and Infectious Diseases, assuring quality control compliance and accurate results. Our laboratory is supported by WebList, a laboratory information system that receives, processes, and stores information generated by medical laboratory processes. WebList is a web-based LIS software that computerizes processes of laboratory operation from customers' registration to generation of laboratory results. Do you ever wonder what happens to your samples when you send them to the laboratory? Let the Department of Pathology and Laboratory and Perpetual Health Delta Medical Center Las Piñas take you on the journey of your specimens. When you arrive at the doorstep of the laboratory, the clinical reception will cater to your needs as you prepare for your tests. This is where you drop off your urine and stool, as well as specimens collected by your physicians. After validating the adequacy and viability, your specimens go to the clinical microscopy and parasitology sections where they are routinely examined. There are also special tests for the same type of specimens done here. Your blood is the most common specimen processed in the laboratory, as it reveals a lot of information about your health. In the blood extraction area, trained experts in venipuncture collect your blood. The blood specimen collected, then forwarded to the officer in charge as the quality control officer for the day to do some pre-analytical phase, such as verification of patient identification, handling of the sample, and sorting out. After the blood sample validation, it is submitted to different sections of the laboratory based on the patient's request. When it goes to the clinical chemistry section, state-of-the-art equipment helps detect accurate levels of the following tests. When we bring your blood to the hematology section, its components are evaluated by well-maintained analyzers and checked by highly skilled technologists. Your blood gets to the immunology section for tests regarding infections and functions of your immune system. Our laboratory also has a part that investigates all kinds of samples to see if there are bacterial infections in the body, and that section is microbiology. The blood bank is also another section of the laboratory that is unique and very crucial as it ensures safe and effective donation and transfusion processes. We also have blood donation programs in collaboration with the DJFI. The histopathology section is also another special area of the laboratory where your samples are processed by skilled medical technologists to be studied by experienced pathologists in order for them to make a diagnosis. We also do SARS-CoV-2 testing, anti-SARS-CoV-2 IgG and anti-SARS-CoV-2 IgM, SARS-CoV-2 rapid antigen. The Department of Pathology and Laboratory Services is located on the ground floor of the University of Perpetual Health Delta Medical Center. We're open 24 hours a day, daily. delivers same-day results, and 6 p.m. onwards for the special procedures. Offers standard health packages or executive health services. You may call us at 8874-8515, local number 151 to 153. We, the University of Perpetual Health Delta Medical Center, fast, accurate, and quality laboratory services dedicated to life and to God's glory. Molecular Diagnostic Laboratory is a semi-automated laboratory equipped with trained medical technologists on biosafety and biosecurity. The MDL team is guided by a molecular-credited course pathologists spearheaded by Dr. Agnes V. Barrientos, alongside with HSCDS Officer Ms. Susana L. Chan, Laboratory Officer Ms. Divine Grace A. Gonzalez, Laboratory Supervisor Ana Camille Laudentia, and Mr. Don Dave B. Clerigo as the MDL Section Head. As COVID-19 pandemic rises, many molecular laboratories emerge and start working hand in hand to ensure the safety of the people. For early detection of the disease, the Molecular Diagnostic Laboratory is responsible for the development and performance of molecular diagnostic tests for nucleic acid targets found in a variety of settings in medicine. In the case of the current pandemic, molecular techniques such as RT-PCR or reverse transcription polymerase chain reaction are essential for the detection of SARS-CoV-2. Specificity and sensitivity of the test is the best way to describe molecular techniques. It is reliable and efficient for the early detection of the virus in the system of a human being, as it targets the genetic material such as DNA or RNA of the pathogen. RT-PCR is a molecular technique combining the reverse transcription of RNA into DNA and amplification of a specific DNA target. It is used to measure the amount of specific RNA needed for detection. RT-PCR specimen type are nasopharyngeal swab and oropharyngeal swab. Both swabs are included in one viral transport medium or tube to ensure the collection of the virus or pathogen. This tube must be in an additional container such as Ziploc plastic bag to avoid cross-contamination as well as spills to other specimens. This contained specimen must be transported with ice in an icebox. The whole molecular diagnostic laboratory is equipped with biosafety controls such as negative pressure, positive pressure, ESCO biosafety cabinet 2, ESCO PCR cabinet, ESCO pass boxes, and UV light. The laboratory has separated rooms with different biosafety controls to ensure the safety of the staff and also to avoid the contamination of the specimen or reagents. Forms are submitted for cross-checking the information provided. The forms needed for testing are charge slip from the hospital information system, line list of the specimen, case investigation form from the Department of Health, Molecular Diagnostic Laboratory form. Official results of patients are released through email and endorsed to inpatients and ER patients. Operating hours: Monday to Saturday, 8 a.m. to 8 p.m. including holidays. Cut-off time: 9 a.m. and 12 noon with a turnaround time of 24 to 48 hours. Located at the second floor of the Department of Pathology and Laboratory Services. The Molecular Diagnostic Laboratory can be reached at 8874-8515, local 953, or email us at phnclp.mdl@gmail.com.
The Perpetual Health Medical Center Las Piñas Pulmonary Services offers care to people with breathing problems caused by injury or illness. For most people, breathing is a second nature. But for those who are suffering from any form of breathing problems caused by injury or illness, each breath can be an issue. The PHMC Las Piñas Pulmonary Services offers inpatient and outpatient services to diagnose and treat disorders. Headed by Dr. Jose Edsel Vitamayo, the Chair of Pulmonary Medicine and Head of the Pulmonary Laboratory, Susan L. Chan as the HSCDS Officer, and Crispin G. Gamboa, the Department Supervisor. The section is staffed round the clock by 18 registered respiratory therapists who are committed to providing the highest quality of pulmonary care. Pulmonary function test is a diagnostic procedure which measures the lung volumes and capacities to assess the patient's ability for effective ventilation. The latest acquisition capable to do this test is the Body Box that can do simple and complete pulmonary function test with and without DLCO. Turnaround time is 3 working days. Peak expiratory flow rate is a simple and quick monitoring of lung flow rates and helps in the assessment of patients' improvement during aerosol therapy. Nebulization or aerosol therapy utilizes topical administration of bronchodilator via aerosol mist. Arterial blood gas analysis evaluates the oxygenation, ventilation, and acid-base imbalance of the arterial blood. Chest physiotherapy is the removal of excess secretion, mucus, phlegm, or sputum from inside the lungs through physical means such as clapping or percussion technique. Invasive and non-invasive ventilation is the latest technology life support ventilators for acute, chronic, or critically ill patients. Invasive procedures or mechanical ventilation is done for intubated patients. BiPAP and high-flow ventilators are examples of non-invasive ventilators. Pulse oximetry is a non-invasive monitoring of arterial oxygen saturation. Incentive spirometry is a breathing exercise using a device which helps prevent or treat pulmonary atelectasis or collapse of the lungs. Sleep study, although outsourced, is done as a diagnostic or therapeutic procedure, or can be a combination of both diagnostic and therapeutic. What is sleep study? A sleep study is a non-invasive overnight exam that allows doctors to monitor you while you sleep to see what's happening in your brain and body. For this test, you will go to a sleep lab. In our setting, the patient will be admitted to a small private room that is set up for overnight stay. While you sleep, an EEG monitors your sleep stages and the cycles of rapid eye movement and non-rapid eye movement sleep you go through during the night to identify possible disruptions in the pattern of your sleep. A sleep study will also measure things such as eye movements, oxygen levels in your blood, heart, and breathing rates, snoring, and eye movements. The data from your sleep study will usually be taken by a technologist and later evaluated by your doctor. A sleep study is used to diagnose many sleep disorders, including insomnia, sleep apnea, restless leg syndrome, narcolepsy, periodic limb movement disorder, sleepwalking, sleep talking, rapid eye movement sleep behavior disorder. Turnaround time is 15 working days. Located at the ground floor of the main hospital building for OPD services. We are open 24 hours, including holidays. You can reach us at 8874-8515, Local 162 and Local 429.
Department of Rehabilitation Medicine. Through a comprehensive and multidisciplinary range of services, the Department of Rehabilitation Medicine of the Perpetual Health Medical Center Las Piñas aims to restore patients to a level of self-sufficiency that will enable them to resume a functional and productive lifestyle. The highly skilled rehabilitation team, supervised by Dr. Melissa T. Gozum and headed by Susan L. Chan as HSCDS officer, composed of physiatrists, physical therapists, and occupational therapists, is committed to delivering high-quality and cost-effective services for acute, chronic, outpatient, and home care cases for the following conditions. First, neurological cases such as stroke, brain injuries, spinal cord injuries, and Guillain-Barré syndromes. Second, musculoskeletal such as myofascial pain syndrome, back pains, osteoporosis. Third, arthritic conditions such as rheumatoid arthritis, osteoarthritis, and gouty arthritis. Fourth, cardiopulmonary conditions. Fifth, pediatric cases such as cerebral palsy, hydrocephalus. Sixth, orthopedic conditions such as fracture, joint replacement, amputation, and sport injuries. And lastly, burn cases. The department also have the most advanced equipment in helping patients for their recovery. We offer services for physical therapy such as high-intensity laser therapy, a Class 4 device with a laser beam of specific wavelength which by mechanically stimulating nerve endings triggers pain relief and through energy transfer causes biostimulation. In other words, stimulation to heal and repair. Unlike the low-level laser therapy, using laser of high power enables delivery of the same amount of energy in a much shorter time, much deeper, and enhances the recovery process. We also offer hot moist pack, transcutaneous electrical nerve stimulation, and therapeutic ultrasound that are used to treat pain and promote muscle relaxation. Paraffin wax bath for wrist and hand conditions, cervical and lumbar traction, bicycle ergometer, treadmill, elliptical bike to promote cardiovascular endurance, NK table and dumbbells and weights used for strength training, manual therapy and myofascial release, assistive devices for mobility like walker, crutches, and cane. We also offer services for occupational therapy such as hand rehabilitation, cognitive skills, pre-speech, pre-vocational, dysphagia, and ADL retraining. The occupational therapist also fabricates splints catered to each individual to consider the principles of design, mechanics, construction, and fit. The rehabilitation medicine is located at the back of the main hospital building, ground floor, at the Neurosciences and Rehab Complex. We are open Monday to Saturday from 8 a.m. to 5 p.m.
Tuberculosis or TB is an infectious airborne disease whose victims continue to be viewed with stigma. Perpetual Health Medical Center Las Piñas joins the country's valiant efforts to win the fight against TB by providing quality, holistic care to tuberculosis patients. Through the Perpetual TB Dots Center, DOTS, also known as Directly Observed Treatment Short Course. As the first private-public mixed TB DOTS unit in Las Piñas City, the center aims to do its part to eradicate the disease in the country. Conveniently accessed at the ground floor of the Unimall building, the Perpetual TB DOTS Center provides comfort and privacy to patients. Open Mondays to Fridays from 8 a.m. to 4 p.m. TB DOTS Center is headed by Dr. Jose Edsel Tamayo as the TB DOTS Coordinator, Ms. Susan Chan as the HSCDS Manager, and Ms. Mary Jean Santos as the TB DOTS Nurse. Together with the PULMA consultants, fellows, and medtechs, we facilitate the comprehensive and reliable tuberculosis assessment, diagnosis, and treatment. The Neurosciences Complex is considered as a one-stop shop for neurological and developmental needs. We offer multiple kinds of specialty medical services. It houses the Neurophysiology Unit and the Neurodevelopmental Center. Our team is committed to develop personalized treatment plans and therapy options for patients with neurological disorders, including stroke, epilepsy, and neurodevelopmental problems. The Neurophysiology Unit is one of the specialty units of Perpetual Health Medical Center Las Piñas. Neurosciences Complex, a facility dedicated to serving the needs of patients with neurological disorders. Equipped with Nicolette 132 channel video EEG, Nihon Koden Neuropac S1 4-channel EMG, NCS, and EP system, our center offers comprehensive diagnostic procedures designed to detect and manage various brain and nerve-related disorders. The unit has a team of highly skilled and credentialed neurologists, spearheaded by our department chair, Dr. Aida Salonga, through the guidance of Ms. Janice Tisha Ako, the department's supervisor, and Ms. Susan Chan, our HSCDS officer. Our neurophysiology technicians are trained to perform advanced neurodiagnostic procedures. Electroencephalography, or EEG, is a test that records the electrical activity of the brain. EEG is an important tool in the evaluation of various conditions affecting the central nervous system. It is most helpful in the management of patients with epilepsy and other seizure disorders, metabolic diseases, headache, tumors, and other neurodegenerative conditions. EEG is a non-invasive procedure and is generally safe and well tolerated. Electromyography Unit, or EMG, is headed by Dr. Aubrey Punzalan Sotelo, an adult neurologist. This is done to determine neuromuscular abnormalities. The test is performed with the use of a very fine sterile needle inserted into the muscle being tested. Although it may cause some pain, the procedure is safe and well tolerated by patients of all ages. EMG testing is being used for a variety of medical conditions, ranging from relatively simple conditions like carpal tunnel syndrome to more complex conditions like ALS. Nerve conduction velocity, or NCV, measures nerve conduction along a specific nerve. These tests helps determine the presence and extent of nerve dysfunction. Stimulating and recording electrodes are used to apply small electrical shocks that measures the nerve's ability to conduct electrical signals. An NCV test may cause discomfort, similar to a mild shock from static electricity. It is generally safe and well tolerated. With a turnaround time of 3 to 5 working days, our center is known for its excellence and competence in giving accurate diagnostic results necessary for diagnosing neurological disorders. Neurodevelopmental Center, headed by Dr. Maria Shelo Malihan, a developmental pediatrician, provides specialist expertise in the assessment and management of patients with neurologic, developmental, and behavioral conditions. The team works with children aged 0 to 19 with a diagnosis such as Attention Deficit Hyperactivity Disorder or ADHD, Autism Spectrum Disorder or ASD, Global Developmental Delay GDD, cerebral palsy, and children and young people with learning disabilities and additional health needs. Services offered are DEF-PED Initial Evaluation, Child Neuro Initial Evaluation, Adult Neuro Initial Evaluation, Occupational Therapy, Speech Therapy, Learning Enhancement Monthly Program, Life Skills Training Monthly Program. All of our OPD services needs to be scheduled as it is mostly done with a medical professional. We also want to avoid overcrowding in our center while we observe safety precautions. Located at the annex of the main hospital building, we are open on Mondays to Saturdays except holidays from 8 a.m. to 5 p.m. You can reach us at 0917-632-1564 or 8874-8515, local 138 for your appointment schedule.